Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you.
Welcome to Dr. Jeff Talks About Sex and Intimacy, where we talk openly about sexual health, intimacy, relationships, and the many factors that influence our ability to live healthily and really healthy, satisfying sexual lives. I'm Dr. Jeff Albaugh, and today we're exploring how innovative technology can give people new options for addressing pelvic floor health, urinary incontinence, and sexual health. This is episode 85, which is crazy. Elitone and Beyond, Innovative Solutions for Sexual Wellness. Well, whether you're joining us live or listening later on in your favorite platform, please know that I so appreciate your time and attention. Thank you for joining us. You are why this podcast exists. Don't forget, if you are on any of your favorite platforms, like us, follow us, subscribe to us, all that allows us to do more here on those platforms. And so thank you for following, for liking, and for joining. As always, I like to remind you all that all are welcome here. Whatever your sexual orientation, gender identity, or relationship style, this is a space and a place for you. You are so welcome here. The mission of the podcast is really simple. It's just to empower and enlighten you with scientific information, evidence-based information that improves sexual health, deepens your loving relationships, so you can live your one miraculous, wholehearted life with more love. Who doesn't want more of that? Today, wow, we're talking about Elitone and Beyond, Innovative Solutions for Sexual Wellness. So pelvic floor health plays an important role in bladder control, sexual function, confidence, and quality of life. We've talked about it multiple times. We've had several episodes on the podcast on this with pelvic floor experts, with advanced practice nurses and urologists. Yet many people don't realize the options beyond traditional pelvic floor exercises, basic pelvic floor exercises, or you might know them as Kegels. I'm joined by Nick Dugan, Clinical Solutions Consultant with Pisces Healthcare Solutions, and Eric Kolb, co-founder of Elidah. We'll explore the science and practical applications behind Elitone, an FDA-cleared wearable pelvic floor stimulation technology, as well as other innovative non-invasive approaches to sexual and pelvic health. We'll talk about who may benefit from these things, how these technologies work, and what the evidence tells us, and where these approaches might fit within comprehensive sexual health care. So my two guests, I'm happy to welcome are Nick Dugan. He is the Clinical Solutions Consultant with Pisces Healthcare Solutions, where he works with healthcare professionals and patients to understand innovative technologies designed to address pelvic floor and sexual health concerns. He has a background in nutrition and clinical care, but Nick brings a practical, patient-centered perspective to the conversation about new approaches to improving function and quality of life. My second guest, Eric Kolb, is Chief Technology Officer and co-founder of Elidah, the company behind Elitone. With a background in technology and product development as an engineer, Eric has been instrumental in developing and advancing wearable pelvic floor stimulation technology. So cool. He brings a unique perspective on the science, the engineering, and the innovation behind creating accessible, non-invasive solutions for pelvic health. I couldn't be more excited to welcome my two guests to this episode. Welcome, Nick and Eric.
Hi, Dr. Jeff.
Hey there. Thank you for having me.
So glad you guys are here, and it's so cool that you guys are really involved in helping with advancing these technologies, especially non-invasive type things like this. I was telling you earlier, Eric, years back, we used garments that had sensors built in because people don't like the probes involved in
Right.
electric stimulation and biofeedback. So I just think it's so exciting that we have these wonderful, less invasive options where you don't have to place a probe in the vagina or the rectum or wherever. So I'm really excited to hear what you have to say. So without further ado, let's first go to your presentation, and then Nick and I will join you again to have a discussion about it.
Sounds great. All right. Very few slides here to talk through Elitone and how it can help many men who are recovering from prostate surgery, which unfortunately can have some negative and potentially surprising outcomes related to continence. Just give a bit of background about our company, Elidah, and the products that we make, which are called the Elitone family of products. My wife and I started this company about 10 years ago, really to address a personal issue she was having with continence. She had 3 kids, as she describes it. She had a 9.5-pound girl and then 13 pounds of twins. So not surprisingly, she had pelvic floor trauma and incontinence issues that really didn't resolve very quickly. And after about a decade of dealing with it, she decided to seek treatments, was not happy with the intravaginal options she was offered or the surgical options that were presented to her. So both of us being engineers, we said, hey, we can do better than this. We sat down, did research, made prototypes, and came up with a fully external solution to treat women who have what's called stress urinary incontinence. She was patient 1, had great results. We went to the National Science Foundation and got federal funding to develop the product and brought it to market about 6 or 7 years ago. We then expanded that technology into another type of incontinence called urge incontinence, which is commonly referred to as overactive bladder. That's where you have the sudden sensation and need to rush to the bathroom, otherwise you might leak. That product, introduced in 2024, is strictly for women. Interestingly, for this year, we were able to get FDA clearance for a male version of the product, and we wanted to specifically focus on men who were recovering from prostate surgery, because that prostate surgery is the most common point in time when a man will experience incontinence and the need for a recovery plan. So we are here really today to talk about Elitone for men. But again, it's based off a long history of technology. Complicated slide here, but just to set the tone, when men go for prostate surgery, the expectation is often very different from the reality in terms of recovery. The expectation is I'll have the surgery, my cancer will be addressed, and I will, after a few weeks, be back to normal. The reality is that recovery can take much longer. They may be recommended to just wait and see how it improves, maybe do some Kegels, go to a pelvic floor PT. And if that doesn't work, down the road, there might be a surgical intervention. We think we can do better, and Elitone is designed to do that. It is a class 2 medical device that uses a technology called neuromuscular electrical stimulation to treat incontinence and really accelerate the healing process. Here's a diagram kind of showing how it works, and I can show you by holding up the product as well. This is called a gel pad. It's a thin electrode that is placed under the perineum. This portion right here goes right behind the scrotum, and then it wraps backward towards the buttocks. The end of that connects to a controller here, a control unit, very small, that then the user increments up by pressing the plus button to increase the intensity of the electrical stimulation that comes out of the device. That causes the pelvic floor muscles to contract and relax in a very controlled and comfortable manner, which ultimately exercises the pelvic floor and brings it back into strength and better function. As the image on the right there shows, the product can be worn under clothing, against the skin, under your clothes. So once you apply it, you can put it back on, put your clothes back on, and walk around and stay busy during your treatments. Now, the treatment's actually pretty simple. We really designed it to be very easy to use. You apply it, as I said, you adjust to a comfortable intensity level, and then you wear it for just 20 minutes per day, 5 times per week for 6 to 12 weeks. At that point, most men are coming back to their physician to get a checkup and see how their recovery process is going. And if needed, they may go a little bit longer with the treatment, and they can buy additional gel pads to support that. We, of course, have done clinical studies on this technology and compared it to standards or baselines where men were just directed to do Kegel exercises at home. And we saw a significant improvement in the rate of recovery that really can amount to almost a little over a 1 month improvement in recovery rate over the first 3 months of post-surgical recovery, which for men who are considering whether or not to go back to work, whether or not to become more intimate again and active lifestyles, that 1 month of improvement is really substantial. The product is available both over the counter, where a patient can purchase it from Elitone.com or CVS, but it does also carry Medicare. It is Medicare eligible for original Medicare. That's Medicare Part B, and we can process that for you. If you have other insurance plans, we can check the eligibility of your coverage. Our goal is to really try to get this product into as many men as possible to help them speed their recovery. And I think that is it for my slides, but I'm happy to turn back to the group and talk about it in more detail.
Wow. Very cool. Very cool. I know Nick brought this to me and showed it to me, and I was really excited about it through Pisces. And I just think it's so great to have this this surface type of way of providing this electric stimulation. It's a really exciting thing. And you think, wow, it's 20 minutes, and then that's just 20 minutes a day, 5 days a week. And I know even pelvic floor physical therapy, we always tell people, it's a long haul. It's not a short thing, right? Don't expect to see improvements in a week or 2 or 3. You may see some, but you really aren't going to know where you're going to land for a couple months. It's just how it works with both pelvic floor physical therapy, electric stimulation, all these things.
Yeah, absolutely. We see it as working not as a competing technology to pelvic floor therapy, but really as an adjunct, an add-on to what a qualified pelvic floor physical therapist and your clinician are going to be helping you with when you go into the clinic, whether it be once a week or whatever frequency. But being able to go home and be an active participant in your recovery with that 20-minute session, it makes a ton of sense, and it's very helpful.
That's really cool. And so, yeah, I think that it's an exciting thing to have for men, and so it has this indication for urinary incontinence. Of course, we use e-stim for a couple different things, including that, but also we use some pelvic floor physical therapy for sexual health things, as well as for pain, some of the pain syndromes that happen and stuff. Are you looking at some of those indications and stuff for the future for this as well?
Sure. So absolutely. So as I mentioned, on the female side of our business, we have the original Elitone is very much like the Elitone for men. It contracts the pelvic floor muscles. It creates an active exercising process of the pelvic floor, lifts it up and releases it. But we do for the female have that overactive bladder product as well, Elitone Urge. So potentially down the road, we could do the studies to support FDA clearance of that overactive bladder product for the male side. And then, yes, you mentioned pelvic pain. There are certainly other areas that we are exploring as well. The use of these small electrical currents in the body is very powerful. And I think you're seeing lots and lots of great clinical applications, both in urology and pelvic floor sciences, as well as throughout the body.
Yeah, it's pretty cool. I know we were looking at when we were looking at the most recent published research, they talk about the best rehab strategies from what they can tell. And there's limited research out there on the penile rehab, but after prostatectomy, but they were saying it's a combination of using the pills, and if the pills aren't doing enough, along with the vacuum pump, along with definitely the pelvic floor exercises program as well. So even though that's really being used more for the continence, the patients are, and the studies are showing it may also help with the sexual recovery and things like that. And certainly we are using pelvic floor physical therapy for premature ejaculation and pain disorders and all kinds of things. So it's exciting to think, and I know we have done some electric stim for pain in the past with our patients, of course, using a probe because that was our only option. So I do think that there's going to be some exciting utility in the sexual health arena as well as the continence arena for these products. It's pretty cool.
Yeah, we're absolutely excited to learn more about that and expand our research in that space. But I think minimally, just for men who gain control of their continence are going to have more confidence with regard to sexual function. And that just by itself is of huge value.
Huge value. Yes. And they're very, and it's very distressing to them if they leak during sexual stimulation, or climacturia, which is leakage during orgasm and climax as well. So it can be a really distressing thing, but it's really exciting because we've had this for women. Now we have it for men. I'm also excited about the OAB category because that overactive bladder, so many people have overactive bladder issues, right? And it's so prevalent. And I think most of our listeners and most of us have experienced at some point where we really have to go to the bathroom, and that sense of urgency. Well, imagine if that's your life, like the patients with overactive bladder, they know where every bathroom in their town is and every other kind of thing, right?
Yeah.
So it's an exciting thing to have that indication for that, but it makes sense because pelvic floor exercises tap into a reflex arc that calms the bladder. So we use those for pelvic floor, for OAB, and even urge incontinence and all those kinds of things as well. And so it makes sense it would work in both those arenas. Very exciting.
Right. Yeah, there are a number of technologies that treat overactive bladder, from implantable devices to fully external devices like ours. And interesting thing is that they're all use very similar stimulation patterns to achieve the same clinical benefit. It's just a matter of where are you delivering that signal to the body. We choose to apply it externally in a form factor that's very convenient. But all of them get great clinical efficacy, and patients find real relief, which is important.
And so that what you showed us, how many sessions does that last for, that external thing?
Yeah, so each gel pad is the blue regions are lightly adhesive, right? So not so strong if they're going to pull out your hair, but enough that they can stick against your skin. Use each of these at least 3 times, but reality probably 5, 6, 7 times, and then you throw it away. They come in a 5-pack. So after each use, you put it back in here. You seal it up to keep it moist and kind of in good condition. Use the next day. After 5 times, throw it away. Grab the next one out of the pack. So when you buy the kit or get the kit through Medicare, it comes with enough for at least 9 weeks worth of treatment.
And of course, that's always the question my patients want to know is it covered, and things like that. So,
sure. Yeah. So you can go to elitone.com/men and buy it over the counter. We have various payment options to make it very affordable. But if someone is covered by original Medicare, that's Medicare Part B, they are eligible for Elitone for men. And their physician can prescribe it, and a prescription is needed to get that Medicare coverage, and they send it to us, and we can help process that. If they don't have a physician they're comfortable going to, we also have access to a telehealth partner, so they can again come to our website, go to our telehealth partners page, do an online assessment of eligibility for Elitone, and then get it prescribed that way. So lots of options.
Very cool. Well, I think we've kind of led into our first question, which is for someone like me with urinary incontinence after prostate cancer treatment, could a device like Elitone be a part of that recovery? And we've somewhat answered that. And how might it fit with traditional pelvic floor rehabilitation? So, and I think you've talked a little bit about this, but they're asking more specifically, how would it fit with my pelvic floor exercises that I've
Yeah,
learned, my
yeah,
physical
yeah.
therapy stuff?
Yep. So you're probably going in to see a pelvic floor physical therapist maybe once a week for 6 or 12 weeks. So you would continue to do that. And this would be something that you would do at home on the days where you're not going into clinic. And there is some research that supports the idea of while the device, whether it be an external device like ours or an internal probe like those that Jeff keeps mentioning, that there is some benefit in having that electrostimulation as well as thinking through a Kegel exercise at the same time. And is that both those together being a bit of an amplifier for success. So,
Yeah,
you
that's
can kind
cool.
of approach it in various ways, talk to your physical therapist and see what they would recommend.
Yeah. And even like you said, that E-stem, when you feel those contractions and stuff, kind of thinking of your contractions along with it as a learning tool of what you're doing, not doing, helps you definitely know what those muscles are.
Right.
That's for sure. It identifies them beautifully. And Nick, I know one of the listeners had said I was seeing earlier specifically for you, it was asking about how you think the vacuum device would work along with some of the rehab that they're doing after prostatectomy. And of course, we have often told patients how important it can be to just do some stretching inside there, not using the rings, but doing some nice stretching. Because I know you guys as well have the vacuum device. So that question came in. I didn't put it in there because I was dealing with different questions and then I ran out of time and I'm like, okay, well, but anyway. So Nick, tell us a little bit about, you guys have the vacuum device and how that, and we can talk a little bit about how that fits into penile rehab.
Sure. Yeah, absolutely. My name is Nick. I'm the rep for Pisces Healthcare. We work a lot with the VA hospital system. We offer a lot of different rehab equipment or DME. And we were excited about the partnership with Elitone because, like Eric had been alluding to, this is a non-invasive and non-pharmacological intervention for pelvic floor therapy. And our goal, focusing within the VA hospital system, is to be able to support veterans not just during their cancer treatment, but as, survivors afterward. And really, we sort of came about this relationship downstream of what we've been discussing. That you can have prostate surgery and a resection and go through pelvic floor therapy, but that this large body of individuals afterward are requiring, DME for uh, urinary leakage and urinary incontinence. And we were seeing those orders and looking for something that could be more proactive, more prophylactic. And to be able to partner with something like Elitone, especially with their new male device, given that the VA population scales, heavily towards males, it was fantastic. And I guess how this relates entirely to the vacuum device is really just that we're building out a suite of products to better support veterans who are experiencing, sexual dysfunction following prostate surgery. And what I really like about the Elitone device is that it's a yes and. This isn't intended to be a replacement. There's a body of evidence to support enhanced recovery with its use. But like Eric was alluding to, you can use the Elitone and you can use pelvic floor therapy. You can use the Elitone and you can utilize the vacuum erection device to assist, during intercourse. The opportunity to be able to pair these products together, I think, amplifies the success we can have with them.
And it's just exciting that the vets also through Medicare, but also the vets have access to these products and these wonderful technologies that will help them along. And so I think, listeners, there's a lot to think about. And when you're thinking about rehab, yes, there were several studies done by Toby Kohler, a friend of mine, did one of the biggest published study about using the vacuum pump for penile rehab, just doing some stretching with it, along with using your other things like the pills and things like that. So it's really designed and done with whoever your provider is, and just working with them on what is the best way. We have always used the vacuum device along because it's non-invasive with the pills and things for rehabilitation, just to do some stretching inside there daily. And patients have done, the studies show it can be helpful in several respects. And so, especially when the pills aren't doing much after prostatectomy, which often they aren't in the beginning, the vacuum offers another solution as well as another rehab strategy. And then, two, with your recovery, all of you out there who are recovering from incontinence, it offers some rehab strategies there too. Pretty exciting. My next question from the listeners was, for someone who is embarrassed to talk about urinary leakage or sexual dysfunction with their healthcare provider, what would you want them to know about the importance of getting help and the options that are available today?
Right. So I can take that one. We get that a lot. I remember one of the first conversations I had with a woman when we were trying to figure out what features the Elitone device need to have. And we're doing a survey. She said, well, let me tell you about my friend. My friend has been incontinent for like 40 years. She's never told anybody. She went on to explain all of these symptoms and how it impacted her life negatively. And she talked for like half an hour. And at the end of it, she goes, that friend is really me. I know. I get it. That is super common, right? It's not something we want to talk about. Patients aren't comfortable talking to doctors. Doctors aren't necessarily comfortable talking to their patients about it. But you have a couple options. One, you can do as I said and kind of self-treat, go online, buy it, and see how it works. Hope you can have great outcomes. But I would really encourage you to overcome that fear and talk to your healthcare provider, because they are there to listen, particularly the kind of more the back end staff. So the RNs, the APRNs, like all the nurses involved, the pelvic physical therapist, they will take the time to talk to you through these issues, even if it seems like you may not be as comfortable talking to the doctor who operated on you and treated your cancer directly.
Yeah, and I know there's usually a team of people there, advanced practice nurses, PAs, nurses, medical assistants that can all work with you. But nobody advocates for you like you. That's the biggest thing you got to remember. I tell my patients and my vets that all the time. No one advocates for you like you. You deserve help. You are worthy of help. And so the bottom line is, I know sometimes it can be embarrassing. These things can be stigmatized, but don't be afraid to bring it up if your provider's not bringing it up, because it is something that you want to address and work on. So how we bring it up as providers, how I usually bring it up is I try to remind people, I'll tell patients, a lot of my patients are struggling with urinary incontinence after childbirth. Are you having any of those issues? I'll normalize it first. And sometimes I'll say to them, after prostatectomy, many men are struggling with erections. How's it going for you? How are things happening with you and your partner? I like to include partners I always invite partners to my sessions with the patient themselves. So partners are always welcome. Some people do that, some people don't, but just engaging and inviting, but you are going to advocate better for you than anybody else on the face of the planet. So don't be afraid to speak up and advocate. Life is too short. Ask for what you need. And believe it or not, as a provider, I can tell you, we want to help you. That's our greatest hope and wish. All we want to do is help you. So please tell us what we can do to help you. And if we can't help you, we can guide you to someone who can on the team or outside the team. That's always my goal. A lot of times we deal with things that are on the periphery, but that makes my job really interesting because we also get to deal with other things that are going on, and I can guide you to the right place to get help for your depression or anxiety or whatever's going on with you. So don't forget, that's really important, listeners. But gosh, a lot of good things. I love your company. Yes, Nick?
I'd like to add as well, just relating to the embarrassment component that we had discussed. Eric spoke well to the multidisciplinary team involved in your care. And Jeff, I love what you were talking about with self-advocacy. But I do also wonder if sometimes there's a hesitation around, whether or not there would be any discrete options for treatment. Like if you're having urinary incontinence following, surgery with your prostate, the concern may be that it'll be relatively invasive to receive treatment for this. And I think that Elitone is an excellent example of something that can be done, discreetly within your own home. In addition to what we had spoken about, meeting with a therapist and involving other pharmacological pieces, I do think that there's a large opportunity for patient awareness about the sense that you can receive treatment for these issues, and you can do it discreetly in your home in a way that doesn't disrupt your life.
That's a great point. That's a great point. That's why it's so good to have a panel of us here, because between us, we think of some really important things to deliver to the listeners. So that is great. Well, I'm going to come back to you for a final thought for our listeners in a minute, but I am going to go to what we do at this point in our program, where we like to bring people back into their body. So as we move towards closing this amazing conversation about this really cool technology today, take a moment, listener, to check in with your amazing body. If you're comfortable, get yourself comfortable. Let's start there. Put your feet on the floor, lay down whatever's comfortable for you to feel relaxed. Get your arms in a comfortable position. Now that you're a little more comfortable, take a slow, gentle breath in and slowly breathe out. Continue that breathing pattern where you breathe in. If you feel comfortable, breathe in your nose and exhale through your mouth. About 5 counts in and about 6 counts out. Breathe. Breathing's powerful. As you breathe, notice your pelvic area without judging it, without trying to change anything. Just notice that pelvic area. Simply acknowledge the work this part of your body does every single day, supporting your movement, your bladder and bowel function, supporting sexual function, and so much more. Take another slow breath in, and as you exhale, allow your body to soften, relax a little into your chair or space or whatever you're in. Keep breathing with me. As you breathe, remember that caring for your sexual health is part of caring for your whole self. Whether you're exploring pelvic floor exercises, technology, medical treatments, or simply becoming aware of your miraculous body, there's no shame in asking questions and seeking support. It's what you should do. Take one more comfortable breath in, and as you exhale, give yourself permission to be curious, to be informed and compassionate, most importantly, compassionate towards your body. Turn some of that compassion you give others on yourself. Well, let's talk a little bit about and have Vic show us what's happening next week on Dr. Jeff Talks About Sex and Intimacy.
In a world filled with distractions, social media, and surface-level interactions, authentic connection has become one of the greatest gifts we can offer, and one of the deepest human needs we all share. But what does it truly mean to be authentic in our relationships? And why does genuine connection matter so much for our emotional, physical, and sexual well-being? In this episode, Dr. Jeff explores the science and art of authentic connection. You'll discover how vulnerability, emotional safety, curiosity, empathy, and honest communication create the foundation for intimacy that goes far beyond physical attraction. Join us on August 25th at 7 p.m. Central Time to learn more.
Yes, please join us next week. You should show up as your beautiful, authentic self. It's going to be a great episode. But wow, Eric, first off, I'm just in awe of what you and your wife created with your company, and what a great niche that you filled with something non-invasive to help with these urinary issues and sexual issues and things. So I'm just so excited about the technology that you have and what you're doing. And Nick, gosh, I love all the work Pisces is doing and you're doing to help vets, to help people with all of these issues, supporting them with non-invasive treatment options that can be really helpful for them in their journey. So I'd like to hear from each of you. We'll start with Nick this time. And what final word would you like to leave listeners with from this episode?
Well, I think I'm leaving this podcast just feeling a sense of gratitude. I feel really lucky to be able to support a product like Elitone and to speak to a physician like yourself who can advocate for, their patients to have these treatment options. Dr. Jeff, I think that you really do a fantastic job shifting the conversation to become patient focused. And I think that's why you and I connected so well in the first place. And Elitone is a fantastic device because it can accelerate your recovery, it can do all these wonderful things, but it has the opportunity to improve your quality of life and regain a sense of normalcy and mitigate some of the complications that often follow, procedures like we've discussed. And so I'm just feeling really grateful to be here, and I appreciate everyone who was in attendance and the questions that we had.
Thank you. That's great advice. And I'm sort of the doctor nurse. So I'm an advanced practice nurse, not a physician, but I work with wonderful physicians too. But just want to make sure listeners remember I am an advanced practice nurse. So, but my PhD is in sexual health research. And yes, I think we really connected because we're both so passionate about how can we put this puzzle together and help patients get exactly what they need to move forward in their healing journey. And it's been fun working with you. And I'm so glad you joined us. Eric, what would you like to tell listeners?
Ooh, right. Parting thoughts. So yeah, thanks again for having us and letting us show you Elitone. I mentioned to start my presentation that while Elitone for men is a relatively new product, the female products have been used by over 40,000 women. And as we have interviewed them over the last 5, 6, 7 years, the most common advice that those women give to women who might be considering a treatment like Elitone is not to wait. Right? In our clinical studies, women often waited more than 10 years of dealing with incontinence before they took action to treat their bodies. Right? That's too long. Right? There are treatment options, whether it be Elitone or others. Go out, seek treatments. Advocate for yourself, as you described, and try to get this incontinence behind you, because your quality of life can just improve immensely.
Yeah, and early intervention is so important. And all the studies, even with rehab after prostate surgery or treatment, says early. Don't wait. Start as soon as you're able to and well enough to begin that treatment. And I think oftentimes, I don't know about you guys, but my wife says men are the worst. We're always putting off. We're like, it'll get better. It'll be fine. But I think early's better. So I think that's really important. Well, listeners, you've gotten to learn about some new wonderful products that you can get over the counter, that you can get through Medicare, and vets can get through the VA. How exciting and wonderful. So there are things out there. Don't be afraid to ask. Don't be afraid to advocate. You are so worthy and you do deserve the best treatments, and nobody will advocate for you like you. So be that advocate and ask. Thank you so much for joining us and learning, and have a good one.
Dr. Jeff talks about sex and intimacy, breaking down the science, setting your spirit free with stories, wisdom, laughter and care, connection and confidence. He'll take